Here at the Sydney Children's Hospital Network, our patients and their families are at the centre of everything we do. Our children are first and foremost. To make sure we provide the best care, all staff members need to understand the impact they have on the patient and family experience, so they can tell you what it's like being in a hospital and how we can help make one of the most stressful times in their lives a little better. We've asked the patients and families to help us make a video. Here are their stories.
Reese has been a patient of Sydney Children's Hospital since just after he was born. He was born next door at Royal Women's Hospital, and he started receiving services here as soon as he left there when he was 8 weeks old. He does have a huge, what I call, hospital phobia. So because of the amount of interventions he's had, he's very, very anxious and frightened a lot of the time.
Basically, he had a mastoiditis, so he had a mastoidectomy, rushed from Southern Hospital over here with a mastoid infection in the mastoid there. We had other trust in them, didn't we?
I don't know.
You don't know?
Do you remember any of that stuff?
Do you remember being in there? No, he doesn't remember much.
Our experience with the hospital started when my son Samuel had a drowning accident, initially with some time in the paediatric intensive care unit, and then initially 4 months on a ward, and then over the last 8 years until unfortunately he passed away, we were here almost weekly and often for months at a time. And one of the other consequences of our circumstances has been an effect on the rest of the family, and unfortunately that has meant that our daughter has also been using services here in terms of mental health support. Coming to the hospital has changed our family significantly, so for almost the last 10 years the hospital has really been a home away from home for us, literally sometimes for months at a time. And you're living here around the clock, you're working from here, family celebrations happen here. It does become a big part of the family.
So Amelia is now 2 and we've been coming to hospital since she's been born. She was in hospital for 4.5 months before we got to go home the first time. And so far, 24 surgeries in 2 years. That's pretty hectic. The first 12 months of her life, she spent 9 months in hospital. It definitely affects our family, and it doesn't just affect Amelia, it affects her brother, her sister, her mum, her dad, and then our extended family as well, because we have to rely on them to look after our other kids while Amelia's in hospital.
I first visited the hospital when I was about 5 years old. I didn't know what was going on, and it was amazingly scary. So I was facing a brain operation, and I've had a lot of operations like that. I've been coming in for chemotherapy, which didn't do a damn thing, which was quite awful. That kind of thing.
Generally, it's already been a very full day by the time we get up here. So yeah, we're anxious, we're stressed out. Often our kids are in life-threatening situations, so yeah, everyone's stressed out.
Hospital usually means something scary to me and my family, as I'm sure it does to many people. But I have been admitted quite frequently, so it's getting easier to get used to how things work. It's still pretty stressful, I think, because there's a lot of waiting around and not knowing what's happening. And I think there's still a lot of distress that comes with being in hospital, to me and for my family as well.
I guess the one thing we'd like staff to know about being a family in the hospital is that it takes a while to get used to the place, and we want this to be the most positive experience that it can be, even though that families are often here as part of something that's going wrong with their family.
When Reese is stressed, we're stressed too, and so we really need the person who's leading the procedure to give us a little bit more time.
Having a daughter in hospital is hard enough as it is. To have the communication and open communication, it makes it different and it makes it bearable, and you know, they appreciate me as a mother, and it makes me feel like I'm doing a good job.
I have a private room. I have plenty of things to distract me. my parents are here. Yeah, and instead I get to have the needle or thingy-majiggy that I put medicine and fluid in my hand instead of in my elbow, which means I wouldn't be able to move my arm.
Yeah, so they used to give him the envelope to put on where he wanted to put them.
Being able to communicate with the doctors more, the more communication there is, the better you feel while you're in hospital.
My mum and dad used to think that I should be kept away from bad news, which included things about me. I like to know. So then I know the reason I was doing things, and I'll offer up less resistance because I'll know exactly what's going on and the reason behind it.
Just taking an interest in your concerns about, the condition that you have, what's put you in hospital. Usually it's when we're in the dark that it's scarier.
You always had a question marks, didn't you? Eh? You always had to know what was happening the next day, where he was going, what operation he was having, and why and how. And made it a bit easier for him, I think, to get his head around it all. So
It's really important that the communication's right because it has to be a partnership. The reality is that the parents are the experts in their own child, and it has to be a team approach.
So we haven't had very many negative experiences, but they have been when people maybe haven't listened to our concerns as parents. And giving him the opportunity, even though he can't communicate well, to have a say in things. A child with special needs or a child with complex medical needs, the parents do know a lot about the way the child reacts to things maybe, and understand little subtle differences in the child that maybe the clinicians don't understand. And so it's really good if the doctors and the other medical staff just take that into consideration.
Makes me feel more comfortable and more confident when they treat me as a person, that they don't have a doctor-parent relationship. They treat me as an equal, and to ask me questions about how Amelia is going and how she's gone overnight, and is there anything that I'm worried about?
Things that have made our experience really good are the warmth and openness of the staff.
We've had some really amazing experiences when things have gone really well, when people have listened to us and just given Reese time and found ways to distract them or get play therapy, child life therapy involved when they can.
So they made you feel like you were just there as a parent to a child rather than a sick child. So yeah, it was really nice. Yeah, they're going to make me tear.
Their focus and their commitment to what's going on with you, their regularity in checking up on you.
Like even when my little one came in to see him like that, like they made him feel welcome, and like he just.
Letter to one of the nurses.
So if you're new to the team, maybe just talking to your colleagues to get the information that will guide you. Reese gets particularly anxious about medical procedures, and so if the staff just listen to us and be guided by what we've learned from child life therapy. So we don't know it all, but we've learned along the way.
I think the main thing is being more friendly and wanting to get to know why you're in hospital. I do understand that nursing is a very difficult job. There's so many patients to look after and a lot of observations to do, but just spending like an extra 2 minutes sort of asking, what are you in for, how are you going, is there anything I can do for you? It really makes a big difference. I've had a few nurses that have been really attentive and really interested in knowing me rather than what I'm in for.
The communication across multiple teams is an issue because the parents become the hub for all the information, and sometimes the teams aren't communicating directly with each other.
It's really helpful when the staff understand something about what you're going through, and that if you're a country Wollongong person like me, often it's a 2-hour trip up to Sydney to big thing. I got a full-time job, another kid, a husband. So to come up here 2 hours, find parking, get kid to oncology, MRI, whatever you're doing, on time, and then get home is often quite a challenge. So if parents seem a little bit short, if we're a little bit edgy, we kind of have reasons for what we're going through, and I know the staff are having a tough time too. So yeah, a bit of patience goes a long way on both sides.
I think that things here are pretty good, especially compared to other countries.
Purely communication. That if staff members can understand that we didn't choose to be in hospital, we didn't choose to have sick children, it is hard. And, for a parent, it's our life. It's not just a couple of week thing, go home and everything's okay. For those frequent flyers, it's a big deal, and it is tough, not just mentally, physically, and it's not just about Amelia, it's about the family, and that is a big thing.
And what about the Starlight Room?
But also giving families the opportunity to...
Hello?
Sorry.
Say hello to the camera. I know.
Cuddle for Minnie? Big cuddles, big kisses for Minnie?